The following advertisement is paid for by HSS, official hospital of the TCS New York City Marathon.
Oh my gosh, I live for this. Action. My name is Kirsten Ferguson, and I am a Peloton tread instructor. I just celebrated my 3-year Peliversary. I am a full-time mom. I have 2 girls that are 9 and 8, the loves of my life, so they keep me very busy and active with their social calendars. But also, movement is a big part of my life. Not only is it my career, but it is my passion.
Don't let anybody take your power from you. Not here, not ever. I'm looking for you to push yourself.
I went out for a long run, and after that long run, I was literally dragging my leg home. And I was like, I need to get this checked out. So that's when I went to HSS and, was like, I don't know what's going on, but I need to fix this. I need to fix it quick because I run for a living.
I talked with Kirsten about all of her options, including continued non-operative, trying to live with it, manage her hip pain, or doing a surgery to fix her hip labrum tear and her hip impingement. Arthroscopic hip surgery is a procedure where we put a camera into the hip and then we use instruments to repair the labrum. So when the labrum is torn, it's essentially detached from the bone. So we have to reattach it to the bone using what are called suture anchors. So we anchor the labrum to the bone using the sutures. And then we do what's called a femoroplasty, which is a reshaping of the femoral head and neck to restore the normal anatomy to remove any impingement or pinching of the hip joint.
I remember waking up like, okay, it's done. This is my day 1 to get back. And they get you up moving right away. They're like, okay, you have PT. I said, I just had surgery. Where's my crackers and my water? And just send me on my way. They're like, no, you gotta get moving.
My name's Snehal Patel. Everyone calls me Snay. My clinical interests are the knee and the hip, so most of my patients are coming out post-surgically after those particular ailments. I tell everyone, my job is to give you a roadmap of what to do. It's to guide you to do what you need to do. And she did that to a T. She went at it.
I really trusted him. He made me believe that I could and would get back to what I did before.
This one thought today we were gonna run.
Today was run day. It was absolutely run day. I was gonna bring my sneakers and everything. Ready. I had the goal of running the half marathon, which I did. And he was out there cheering for me that day. And I remember texting him after, wow, wouldn't it be so wild if we did the New York Marathon? And we're laughing about it, and now here we are.
For someone to run the marathon after having hip surgery and then going through it, I knew that this is what she wanted to do, and I'm like, all right, if you want to do it, I will do it with you.
I think that her long-term prognosis is excellent. We define success based on 2 parameters. One is sort of a minimal clinically important difference, so getting back to your activities of daily living, being able to walk without pain. And then we talk about substantial clinical benefit, where you're able to get back to a life as a Peloton instructor and run marathons. And so I would say that Kirsten's surgery was a substantial clinical benefit.
HSS has completely changed my life. I went to them in one of my most vulnerable moments and trusted them, and I could never be more grateful. I would 1000% recommend them time and time again.
The preceding advertisement was paid for by HSS, official hospital of the TCS New York City Marathon.